Hi, it's Renee, staff PT at the Kirk Center for Healthy Living, and today I'd like to talk to you about erections. So what's an erection? Well, it's something that happens when enough chemistry happens in the body that the arteries of the penis dilate or expand and the veins of the penis constrict or contract, and more blood flow stays in the penis than leaves the penis. And the spongy tissue of the penis kind of fills with blood. Things become engorged, things become bigger and harder. Okay, so what's normal? Well, a healthy male would have about 10 to 20 erections per day. 3 to 5 of those happen overnight, and it happens when you're in your deepest sleep, so that REM sleep when you are dreaming. Why do I care about erections? Fair question. It's really the only way that the penis tissue gets increased blood flow. So for the rest of our body, if we go for a walk or a run or it's hot out, our blood vessels dilate and blood flow goes to the extremities or the muscles or the different parts of the body. This doesn't happen at the penis. Really, the only way we're going to get increased blood flow to the penis is through erections. Why do I care about that? Well, some of my favorite patients to treat are men, and some of my male patients have erectile dysfunction. So that's when maybe erections aren't happening at all, or they're happening, but they're not lasting long enough, or they're not the quality that a guy would want for sexual activities. When does that happen? Well, there are certain conditions that predispose men to erectile dysfunction. Cardiovascular disease is a big one. So high blood pressure, high cholesterol, diabetes, COPD, sleep apnea, interrupted sleep. Like I mentioned, 3 to 5 erections happen overnight during that REM sleep. If you have sleep apnea or interrupted sleep, you're probably not getting those overnight erections, and you're missing 3 to 5 penis workouts a day. Not so good. So sleep is very important. Stress can do it, and also just maybe having some relationship issues. If you're not entirely comfortable with your partner, if you're not entirely interested in your partner, but that's not always the case. So I see patients with erectile dysfunction. I also see patients with a condition called Peyronie's, which is when little hard pieces of tissue form in the penis, and it can cause the penis to curve. So that is also not very functional for activities that require erections. So what can you do about this? Well, you can do pelvic floor physical therapy. So if you notice that maybe you haven't noticed that you've been having morning erections, or things are just not the quality or quantity that you would like, you could ask your doctor for a referral to pelvic floor physical therapy. What would we work on? We would probably assess your pelvic floor muscles to make sure that they are able to contract and they're able to relax. Tight pelvic floor muscles can cut off blood flow, nerve activity, and it could contribute to erectile dysfunction. So we could teach you how to relax your pelvic floor muscles. Pelvic floor muscles that are maybe kind of lazy, we can teach them how to contract to wake up a little bit. So we can down train muscles or we can up train muscles. Other things we can work on, if you have any scar tissue anywhere, say you had your appendix out at some point or you had a back surgery, we can work on scar tissue to help nerves carry the right messages to and from the penis and to help blood flow travel to and from the penis. So there's a lot of things we can work on in the clinic that could help erectile dysfunction. And also Peyronie's. We can work right on those plaques. We can work on fibrotic tissue. There's things that can be done if you speak up right away. That being said, if you notice things, speak up. Tell your doctor, ask for help. If you don't want to do physical therapy, there's also medications that can be offered, and that's like your Viagra and Cialis. Those are medications that dilate blood vessels. I did a whole little spiel on vasodilators, Viagra and Cialis, and that could also kind of be troubleshooting. So, like if you went to your doctor and said, hey, I think I have erectile dysfunction, and they say, oh, here's a sample of Viagra. If it works for you, great. Then we know it's probably chemistry and a blood flow issue, and we can work on that in PT as well. If you take it and it doesn't help, then we know there's something more complicated going on. You can take medication and do PT at the same time. Let's see, what else do you need to know? I think that's it. So, bottom line, if you've noticed, maybe you're not having morning erections, maybe you're not having as many erections, or they're not the quality or quantity that you would like, talk to your doctor. The sooner, the better. If you would like to try pelvic floor physical therapy, ask for a referral. If they say no, they might want you to see a urologist, or if they say no, keep asking. See another doctor, talk to the urologist, keep going until you get the referral that you need. In the state of Illinois, you do not need a referral to do physical therapy. Sometimes your insurance company may require a referral to pay for it. So you could find out if you even need a referral, and it would probably just be needed by your insurance company. So ask for pelvic floor physical therapy. We treat men at the Kirk Center. If that's not the case, maybe try a vasodilator, your Viagra, Cialis medications. If it helps, great, use them. Let that medication send blood flow to the penis, bring oxygen, nutrients, keep that tissue healthy. You could also do both. Maybe try the medication, come to physical therapy, we'll see what we can do. Maybe you won't need the meds anymore. Just keep in mind, the healthier you are, the better. So if you're having high blood pressure, high cholesterol, if you have a lot of stress in your life, if you have poor sleep, those are going to be things that you need to work on as well. Okay. Well, if you have any questions about how pelvic floor physical therapy can help with erections, please feel free to ask. You can ask here, or you can contact us through Facebook or give us a call. And I hope that we will see you soon to work on things. Take care.